like to remind you that if you are experiencing symptoms of a heart attack, stroke, or any life-threatening medical emergency, please call 911. Please do not delay seeking treatment during the COVID-19 epidemic. Most Providence emergency rooms are open, and CDC-required safety measures are being taken to protect patients and hospital staff. If you are unsure of your symptoms, please use our telehealth services and speak with a healthcare professional that can better assess your symptoms and provide direction on the best course of action. Please do not let the worry of COVID-19 cause delay in seeking out treatment if you are experiencing a heart attack or stroke. Every minute treatment is delayed can be fatal. Thank you.
I just want to remind you that the information provided during this event is for educational purposes only. It is not intended, nor is it implied to be a substitute for professional medical advice. Always consult your healthcare provider to determine the appropriateness of the information for your own situation. If you have any questions regarding medical conditions or treatment plans, please consult your physician. Participating in this event with this clinician does not create a physician-patient relationship. Now that we have that out of the way, thank you all for joining us. And today, joining me is Dr. Robin Henderson. She serves as the Chief Executive for Behavioral Health for Providence, Oregon. She also serves as Senior Clinical Advisor for Wellbeing Trust, whose mission is to improve the mental, social, and spiritual health of the nation. In this role, she provides clinical oversight for investments in programming, ensuring they are consistent with the mission and values of both organizations. And now that we have that, thank you so much for being here, Dr. Henderson. So we had talked about doing a Facebook Live. We actually did a Facebook Live a few weeks ago talking about grief. And then we talked about doing a Facebook Live sort of as the, I guess, momentum of COVID-19 started to progress. And that was about a week and a half ago. And so much has now changed. We were just talking about this earlier. So I guess to start off, one thing I've noticed is that we're all being affected by this, but it seems like we're all being affected by this differently. Is there a normal way to react to this and have this impact us?
The short answer is no. There is no normal way, because this has really never happened in any of our lifetime. To have a global shutdown, to have all of our students all across the country be out of school for an indefinite period of time, this has never happened. We've seen pockets of this, and we have some modeling that we can do after like a natural disaster. But even then, natural disasters bring other consequences that allow for different types of esprit de corps to develop, and people come together. And in this event, we can't come together in the same ways we're used to. So there's really not a normal way to respond.
You actually kind of touched upon something I was going to touch upon later, but I do feel like we keep hearing stay home, and we have to isolate. And that is something that, to your point, is so different, I think, for human nature. You know, after 9/11, for instance, people were coming together, and, you know, after the fires, you know, in California, for instance, people gathered together. And here I feel like there's sort of this overwhelming sense of hopelessness or helplessness, being told to just sit on your couch. Was there anything that we can do to sort of, I mean, in reality, it sounds like sitting on the couch is actually being part of the equation to making things better. But is there anything that we can do to sort of help change our mindset a little bit? Because I think we as humans want to be more proactive.
Right. Well, the biggest thing that we can do is set a routine and set a schedule, especially if you have children. Setting a routine and a schedule and giving some level of predictability and control is something that's going to help us start to feel more normal in a space that's completely not. Many of us are working from home. Some people for the first time. I've worked from home before. My husband happens to work from home every day. So we've completely invaded his office space. We've had to like set some boundaries around that and things like that. But having a schedule where you're going to work from home, you've got your setup, you've got your computer, make sure you take breaks, make sure you take bio breaks, make sure you go and take that 15-minute coffee break. Or, you know, actually, it's a really good idea to get up and walk around at least once every hour. Do things to break up your day a little bit. If you can, go outside and take a walk. It's not quite a great day out here. It's raining right now, but there are some people carrying, umbrellas, and they're walking with their dog and things like that. But scheduling time for exercise, scheduling time to eat, making sure that you're eating healthy meals. these are the things that we can do to help the new normal.
So sort of on those lines, I think because this is such a scary time, and we are dealing with so much anxiety, and we're dealing with so much uncertainty, at what point does it become maybe problematic for us when we aren't able to schedule these things, or we aren't able to, like, is there room for like a wiggle room, I guess, where it's like, okay, if you can't get up and motivate yourself for 2 days in a row, it's okay based on things that are going on? Or is it that, you should, it's not, it could be problematic if you can't, get yourself motivated every day? Like, at what point is it that we should be concerned? Because this is such a new normal. And I don't think that any of us really, a lot of us, I guess, adapt to change that easily.
No, and that's a really great point, because this is very scary for people. And if you find that you're getting overwhelmed and you can't get out of bed and you can't get up in the morning, especially if you have responsibilities like a job and family and children, that's a great signal that you need to reach out to your healthcare professional. At Providence, all of our clinics here in Oregon have behavioral health providers, psychologists who are attached to their clinics. And about a week and a half ago, we sent them home and said, you need to do your work from home. So they're still scheduling appointments, and they're doing them via telemedicine. And much of what we're doing right now in all of our outpatient clinics is through telemedicine. So therapists are out there and they're waiting to talk to you. But not everybody necessarily needs to talk to a therapist. They may want to go to church, and church right now is closed for them. But there are so many online church availability right now. You could probably find, a church service 24 hours a day. I do know that for many of us, people who are in recovery, they are used to going to AA and NA meetings, right? Well, a lot of that community has also moved online. So you can find probably 24 hours a day, I think at this point, an AA or an NA meeting online. But we've got to do things to connect, because we're social beings. Many of us may think that we like this, and this is great to get, a week to watch Netflix and catch up on my favorite TV shows. But I'm also kind of going nuts here. It's a little bit crazy, and I need to feel connected to other people. So how do we set intentional times to connect with people? If you have a group of friends you hang out with, then hang out with them online. Get together and have a virtual happy hour over FaceTime. Have a tea party and drink tea. Have a cooking class with each other, but connect.
That's actually, I saw a friend from high school, her daughter's birthday was yesterday, and they did a virtual or an online birthday party for her, which I thought was really sweet. And, when you're a little girl, your birthday means a lot. So it's nice that you can sort of have some semblance of normal. But, I do think too, in all of this, at least I know for myself, there's been definite waves. There's been panic, there's been confusion, there's been sadness, there's fear, there's worry about family members and whatnot. So this is not really, I feel like, a very linear experience, I would imagine, for any of us. What are some ways emotionally that we can help sort of regulate maybe what are some ways we can help, or some tools that we can regulate our emotions throughout this whole process? Because I feel like that's important.
It is important. And it goes back to the idea of, what are the things we can control and what are the things that we can't control? COVID-19 is a very random virus. It's attacking the old, it's attacking the young, it's attacking a number of different individuals. And none of us know one day to another when ourselves or someone we know is going to get sick. And we don't know how sick someone is going to be.
Right.
We know there are some indications that people who have immune suppressed systems or lung issues or things like that are going to be affected differently than people who are perfectly healthy.
Right.
But we've also seen perfectly healthy people end up in an ICU on event.
Right.
So that type of randomness is very scary, which means the things we can control that will help us self-regulate are wash your hands. When you go outside the house, wash your hands. When you come back in from being outside, wash your hands. The things that we can control. I, for instance, have to go periodically into the hospital. I make very sure that when I come home, I stay at least 6 feet away from people. I take off the clothes that I'm wearing, put them into the laundry, and I go take a quick shower. And that's what helps me feel better about them being able to interact with my family and to reduce exposure.
That's actually a really good point. And I feel like that's really, it may seem like such a small thing, but the way in which we can kind of control things that we're on a smaller level when we're unable to control things on the bigger level. That does make a lot of sense. What about how should parents be dealing with this in terms of their children? Because this is obviously something we've never seen before. And so I'm sure that there's a lot of emotion and a lot of questions and a lot of things going on.
You know, all children, whether they're young or they're teenagers, are going to struggle with understanding, why can't I just go see this one friend? Why can't I just go hang out with this small group of friends? It doesn't make sense to me. And there's a variety of different levels of control that we have over that. With very young children, we can control that, and we could go, oh, look, this is fun. Here's FaceTime. We're going to do a virtual play date. Isn't this great? And that's going to become some of the pieces of the new normal. But as children get older into that preteen phase, they're going to start to balk back at you and go, you're overreacting, mom. You're overreacting, dad. You should let me do this. And it's harder for them to understand. So as it becomes harder for them to understand, it becomes more important to help them understand the impact that social distancing can have on reducing the pandemic, and to be able to show them some of the computer modeling and some of the graphics that are out there on the CDC website and on other websites that really show, you know, if we take this 2 weeks or however long this period of time is, and we stay here in this house, not only are we protecting ourselves, but we're protecting everybody we come in contact with. And if everybody does that together, we could flatten the curve and we may make a different impact in this. And those types of things are important for the preteens and teenagers to understand. We had a lot of those conversations at my house this weekend with the teenagers who live here, and talked a lot about how, yes, this is disruptive, and yes, you're really healthy, but the reality is you could be a vector. And helping teenagers understand what it means to be a vector really started to affect their understanding of how they could hurt someone else.
You know, you actually bring up the point about how, you know, being part of, by doing these 2 weeks, we could be a part of the bigger cure. Mm-hmm. What about the people that don't seem to want to necessarily follow the rules, or they feel like they can go out and, you know, for instance, this weekend at the beach here in LA, people were, you know, it was as if it was July 4th. And I keep seeing a lot of people on social media being so upset, and I understand it. I get the frustration that people feel about it. But I also feel like during this time when we're almost sort of vulnerable already, the emotional, taking on that sort of negative emotion might not be the best for us. But how do you deal with people, even people that you may know that don't seem to think that this is a big deal? Is there any way that you can advise?
Well, you know, in Oregon, those people are going to be facing a Class C misdemeanor, because Oregon has just enacted very strict guidelines around who can be out, where you can be, what you can be doing, and what businesses can be open. Now, we'd already enacted you need to stay 6 feet away from each other. We suggest you do this. And I was out in downtown Portland today. I had to go to a hospital, and there was a nail salon open. And I'm thinking to myself, a nail salon? No, that's kind of interesting. And then a friend called me up and said, how come my tanning booth is open? This doesn't make any sense to me. And these things all are, I appreciate that these are small businesses that are struggling to survive. And when everything is over at the end of the day, we're all going to need to get our hair done. We're all going to need a pedicure, and that's it. Right. And the best way that we can support each other and get through this is to make the hard choices now. Now, things like supporting restaurants and stuff like that, those are ways that we can really, help support and continue the economy and continue to support our neighbors and our communities. And that's really great. But that doesn't mean you need to all sit down together outside and eat your meal together.
True.
We'll grab it for a reason.
No, that's a really good point too. And I think that, you know, we were actually talking before, it is such a new normal, not getting your hair done, your nails done. And these are a lot of things that I feel like for some people, that is their way to relax, is to go get a manicure, a pedicure. And so I do think that in this new normal, we're also having to find new ways to take on self-care and take on, you know, ways that make us actually feel good. Right. What about, what advice would you give to people, you know, in this day and age, people have extended family that is long distance, for instance, and or even aging parents. What advice would you give to people who may be worried about family members, and again, due to social distancing, they may not be able to be in contact with them? How, and some of them may actually not even be that tech savvy too. So how do you deal with that sort of that unknown?
Even though they may not be able to FaceTime, most elders, most seniors can text, and many of them are actually good at it. Over the weekend, my 90-year-old mother is staying alone in another town, and the television set has some type of remote that was very complicated. So I went out online and I found a tutorial on YouTube, and I sent it to my mother, and she was able to watch television again, right? So it's things like that.
Yeah.
Figuring out, what is it that you need today, Mom? What do you need so that you can be comfortable? What kind of connection do you need? What can we do for you while you're in this period of isolation? Those are important. We need to reach out to our seniors. Another great thing, Grandma and Grandpa love to read stories. So if you have young children, asking Grandma and Grandpa to schedule, hey, 9 a.m. is story time, and Grandma and Grandpa are going to read you a story or tell you a story or whatever. It really gets them engaged in being an important part of a child's life while that child is at home. It gives them a comforting presence of Grandma and Grandpa, who doesn't love Grandma and Grandpa? They're kind of like warm cocoa, right? With whipped cream and sprinkles. And it's part of the comfort that we wrap ourselves in. But when you talk about self-care, we've got to develop some new self-care rituals. Maybe my new self-care is I'm going to take a bubble bath every day, and I'm going to have a cup of chamomile tea, or whatever it is that I might drink at that point. But we've got to figure out some other ways to take care of ourselves during this tough time.
Yeah, no, definitely. You actually, when you were saying checking in with like your parents and stuff, you brought up a good point. What are some questions, I guess, that we should be asking maybe ourselves or others, in terms of what you said, what do you need today? Like, are there some questions that maybe we could all write down and sort of have a checklist, I guess, to make sure that the people that we care about are really feeling like they're heard and that they feel connected to us during this time? Are there questions or ways that we can like check in with ourselves, but then also check in with others to make sure that they're okay?
Kind of getting grounded with ourselves. It's the idea of, when I think about it, how am I feeling today? What's my mindset? Am I in a good mood? Am I in a bad mood? If I'm in a bad mood, what's that about? Maybe I'm frustrated because I'm stuck at home. Well, I need to reframe that and start thinking about the fact that I get to be safe at home today.
Right.
I get to be safe at home and keep my family safe. If I'm getting scared about getting sick, and that may be something that happens for someone, happens for a lot of people. Well, if I get sick, I'm going to self-isolate. I'm going to wash my hands, and I'm going to decrease the chances that I'm going to be exposed. One of the especially scary populations right now, though, are our healthcare workers. Our healthcare workers are on the front line. And for them, they're literally running into the fire right now and putting their lives on the line for all of us. So as somebody who may not be in healthcare, making sure that you take that opportunity to thank healthcare workers for their service, to think about the things that you could do to brighten their day. I mean, we're all talking about masks and all these other things that we could donate, but you know what a lot of healthcare workers could use right now?
Thank you.
Toilet paper, people. Toilet paper. Think about the things that, that when you get off shift and you're going home,
right,
have your groceries, there's not much left some days on the store shelves.
No, that's very true.
To donate those types of opportunities. At Providence, we've had a lot of opportunities come from restaurants and hotels who've donated different types of experiences for our healthcare workers when life comes back to normal. And we'll see that people get those things. But in real time right now, there are some things that we could do right now today. And that does go to that idea of when you wake up in that panic of, I only have 10 cans of beans. What am I going to do? I usually have 15, but I've only got 10. And reminding yourself that, I have enough for today. I have enough for right now. And I'm going to make my shopping list. And when I see that there's a wall of beans, I'll take 2 cans because somebody else may need 2 cans too.
Right. No, that's, yeah.
I went over the weekend to a local friend, Meyer, and there was a pallet on the floor with toilet paper on it. And the fascinating thing was, here was everybody walking up, and some people needed toilet paper, so they took a package. And many people didn't. So they didn't. And we're starting to get back and settle into that normal of it's going to be okay. We're going to all get through this together. Because yes, things are shutting down, but everywhere things are shutting down, we're making sure that essential services are available. We know that we have to have gas stations so that healthcare workers can get to the hospital and work.
Right.
We know that we have to have grocery stores for all the same reasons.
Right.
It's going to be okay, but it's going to be tough.
One last question. What about how this could be triggering, or could this be triggering PTSD in people? And if so, what are the signs of that?
Definitely. For people who have experienced trauma in their life, much of what is going on, the panic, the lack of control, can definitely be triggering your PTSD. And that is perfectly normal. And that is a great time to reach out to your healthcare professional, to a therapist. There's a lot of therapists out there right now who are doing televisits, and now's a great time to work on yourself. I mean, think about it. You've been putting off getting therapy for a while. Now's a great time to do it. And you can do it from the privacy of your own home. You can help support your community. You can work on your issues, and you can take care of yourself.
Oh, I love that. Really quickly, you had mentioned before a new website or a website.
Yes.
Sorry.
Yes, no. So for parents and teachers, we just launched a new website today called Work to Be Well. You can find it at work2bewell.org. And on that website, we have all kinds of resources for teenagers and middle school students who are curious about how they can stay well, what they can do to be positive. It's got great examples that other groups have done, challenges you could do with your friends online, like the wellness challenge, like how to be well, all other types of things like that. It's got video messages from celebrities and influencers. But for teachers, it's also got curriculum about how to teach kids to recognize the signs of anxiety, depression, how to engage in self-care, and how really to respond to a friend when they're in crisis using eCPR. Those types of things are really great opportunities that we have for our youth and also for teachers who are going to be in this digital space for a while. Providence and the Wellbeing Trust and #ICanHelp have made those resources available for free, and we want people to take advantage of them. So check out our website, give us some feedback. You will see blog capabilities coming up there so that we can be more interactive, but we had to get started somewhere, and now seemed like a great time to do it.
I think our time is this is crazy. I didn't realize it had already been 20 minutes, but our time is now up. So I just want to thank Dr. Henderson for being here. Thank you so much. I know I gained so much from this. Everything all the advice that you gave, and, it is such a crazy time that we're going through. And I do think that, as I'm sure you agree, mental health is incredibly important. And so I feel like the information you gave us all is just incredibly valuable. So thank you so much.
Thank you, Brett.
And
thank you for your feed.
And to everyone for listening and watching. If you are looking for help with processing anxiety or other medical advice, please visit providence.org. You can also follow Dr. Henderson at Doc Rob Henderson on Instagram, and you can follow the Her Feed at the Her Feed on Instagram. And also make sure that you follow Providence, if you don't, at PSJH on Twitter and Instagram, and you can find their page at Providence St. Joseph Health on Facebook to learn more about Providence St. Joseph Health's mission, programs, and services. Visit future.psjhealth.org. Thank you, everyone, for tuning in, and we'll see you next time. Bye.
Bye.
Stay safe, please.